Hey there! So today, I will be your drug. So please allow me to introduce. My generic name is METHYLERGONOVINE. My brand name is METHYLERGENE. While my chemical name is a bit challenging, so it's right here.
Drug classification. For my therapeutic classification, I am an oxytocin. For my pharmacologic classification, I am an ergot alkaloid. For my pregnancy category, I am in pregnancy category C. Contraindicated during pregnancy because of my uterotonic effects.
So my mechanism of action is that I directly stimulate the vascular smooth muscle in the uterus, or also known as the myometrium, increasing its tone, the rate, and the amplitude rhythmic contractions. Thus, I induce a rapid and sustained tetanic uterotonic effect, which shortens the third stage of labor and reduces blood loss.
Pharmacokinetics. METHYLERGONOVINE can be administered to the body through 3 routes. These are through per aurum, intravenous, and intramuscular. In per aurum route, my onset is 5 to 10 minutes. My peak is 30 minutes, and my duration is 3 hours. In intravenous route, my onset is immediate, my peak is unknown, and my duration is 45 minutes. In intramuscular route, my onset is 2 to 5 minutes, my peak is unknown, and my duration is 3 hours. Going back to the per aurum route, my bioavailability was reported to be about 60% without accumulation after repeated doses. I am rapidly absorbed in the GI tract and distributed in the plasma, in the extracellular fluid, and in the tissues. I am metabolized in the liver and excreted through the urine and the feces. My half-life is 0.5 to 2 hours.
Okay, so now let's talk about the indication. So as a drug, I am used to manage uterine atony, subinvolution of the uterus following the delivery of placenta, and also I am used to control uterine hemorrhage in the second stage of labor.
Contraindications and cautions. The contraindications in using METHYLERGONOVINE are the hypersensitivity to the drug, the METHYLERGONOVINE. Next is hypertension, toxemia, and pregnancy, except during the third stage of labor. The cautions for using METHYLERGONOVINE are the severe renal or hepatic disease, coronary artery disease, or those patients who are at risk for coronary artery disease, such as those who have diabetes, who are obese, who are smokers, and those who have hypercholesterolemia. This also includes the concurrent use of the CYP3A4 inhibitors or the protease inhibitors. Also, the acute peripheral vascular disease, sepsis, and the second stage of labor.
So aside from a therapeutic effect, there are also things that you need to watch out for when you introduce me to your body. First is in your digestive system, in which I could cause nausea, vomiting, stomach pain, diarrhea, and unpleasant taste in your mouth. Second is in your muscular system, in which I could cause leg cramps. Third is in your integumentary system, in which I could cause increased sweating and skin rash. Fourth is in your nervous system, in which I could cause headache and dizziness. And lastly is in your special senses, in which I could cause ringing in the ears.
The next and last part is the nursing responsibilities. So these are the actions and interventions that the nurse must do when administering METHYLERGONOVINE. So before administering METHYLERGONOVINE, the nurse must first assess the patient for the mentioned contraindications and cautions, such as the hypertension, toxemia, hypersensitivity, or the hepatic or renal disease, to prevent any untoward complications. Next is to physically assess the client or the patient. Assess the vital signs, particularly the blood pressure and the pulse rate, because the drug may exacerbate patient's condition with high BP and pulse rate. Next is to determine the baseline serum calcium level, because the effectiveness of the drug may decrease with hypocalcemia. Next is to assess the client for any evidence of bleeding before administration. During the administration of METHYLERGONOVINE, the nurse must inform both the patient and the family about the reason for using the drug. Next is to inform the patient about the adverse effects of METHYLERGONOVINE, such as the nausea, dizziness, increased blood pressure, headache, and ringing in the ears. Next is to monitor the patient's vital signs, particularly the blood pressure and the uterine response during administration. And lastly is to administer the appropriate dose of drug as indicated to ensure beneficial effects. After METHYLERGONOVINE administration, the nurse must monitor the patient's response to therapy. For example, the patient's blood pressure, pulse rate, uterine contractions, and hemorrhage. Next is to assess the patient's extremities for color, warmth, movement, or for any pain, and report chest pain promptly when observed. Also, provide support with ambulation if dizziness occurs. Next is to provide comfort measures to help the client tolerate the drug side effects. And lastly is to monitor for presence of adverse effects. For additional and further patient-family education, the nurse must inform them to avoid smoking because it causes increased vasoconstriction. Also, inform the patient and the family to report if there is increased cramping, bleeding, or foul-smelling lakya. Also, inform them to report if the patient is pale or has cold hands or feet because it may be a sign of a possibility of diminished utilization.
That would be all for our autobiography of drug. I, Olga, and my partner Philip are METHYLERGONOVINE, and we hope that you learned something. Thank you for watching.